Hey, this is Dr. Hugh. You need to listen up. Why is that? Because what I'm about to go over could save your life. It could bring clarity to your case. It could change your case around. It could bring understanding on why you're suffering so much. Just like this case I'm going to go over, and we're going to call her Mary. So, this is what's happening. Mary comes to me. She has lots and lots of problems. And guess what? They're all a mystery. She goes to the conventional system. We don't know what's going on. We think it's all what? In your head. Why am I pumped up about this? Because I know you can get better. I know there's people out there that are suffering that just need the correct guided path. I just got off a woman today. Her name is Donna. She's been suffering for years and years and years. She just gets off the phone today and says, these are the best few days I've ever had in a long, long time. More energy, feeling better. And you know what? When I start connecting the dots and I start changing cases and I reverse cases and get cases better, it makes me happy, and it should make you happy that there's an array of hope out there. So I'm fired up here because you know what? This stuff is clicking for me. It's clicking for people that are coming to me and getting better. This is a very important case. So stay tuned so you can understand what's happening. Okay, let's get into this. Okay, so this is her initial paperwork right here. So this is what she comes in with. Her name is Mary. Okay, I think she's in her mid-50s. Lots and lots of problems. She has seizures. 5 to 6 seizures every single day. And everything that we would do, like little light stimulation, causes a seizure. Too much water causes a seizure. Too much pressure will cause a seizure. What does that tell me? And what does that tell you if you're suffering with some kind of neurological disease? Is that her brain is very, very fragile. It's firing very, very quickly and little stimulation. Cannot walk. Right? Cannot walk. This is how debilitating this has become in society. And just people go into the conventional system and they just get mauled over. They get damaged. And I'm here to tell you, you don't need to stand up for that. Call me. Click the link below. Somewhere on this page, I got a lot of content. Get in contact with me so we can steer you in the right direction. My dad died at 69 years old on 14 medications and 400 pounds. I don't want that to happen to you. I lost 80 pounds at one time. I was on my dad's path to sickness and disease. I'm like, there's no way this is going to happen to me. And I don't want this to happen to anyone else. Extreme fatigue that they can't figure out what's happening. Brain fog, memory problems, concentration problems, and insomnia. Now, we did a very thorough functional medicine workup. We did 10 vials of blood. We did an organic acid test, which is urine, and a mold test, which is urine. Guess what? These 3 tests pretty much came out clean. Very, very good. Like, I look at someone like this many problems, I'm like, okay, all this stuff is going to be lit up like a Christmas tree. Guess what? It wasn't. Then we did this other test. This is an autoimmune test against your neurological tissues in your body, and this was the smoking gun. We found what is happening and what's making the correlation. So what this test is right here, this checks to see if you have autoimmune disease against these different tissues. Now, if you're watching this, you can go to my Facebook page, my YouTube station, my website, and I have more content on this. But I just want to focus on Mary and her problems and what her lab's saying. Hopefully you can get some information out of this and a possibility for hope, because we found answers. Now we just got to work the plan. Find the answers, work the plan. So this checks if you have an autoimmune disease in your body. Every person that I've had that's been damaged by antibiotics, not one single person has not come back with an autoimmune disease. So if you're suffering from a chronic condition for years and years and years, guaranteed, I shouldn't say guaranteed, high probability you have an autoimmune disease and no one's checked. This is a very specific lab in California that does this. You can't get this in a conventional lab. You can say, well, I went to the lab and they checked me for antibodies against tissues. They didn't do this test. This is a unique test. They have a patent on this technology here on this. So let's go over this. So let's go over her symptoms. So seizures, can't walk, extreme fatigue, brain fog, insomnia. All right. Now, this is what we found. Anything here, would be the results right here. So anything that's in yellow or in this pink is out of range, meaning it's positive, meaning that you have an autoimmune disease against your tissues. And in here, this is normal. Now, let's start down here a little bit. Let me just go down here just so you can see the full thing at once. Okay. So first thing we do is we have autoimmune disease against your adrenal cortex, your adrenal glands. Okay, what do your adrenal glands do? They give you energy. What does she have? She has extreme fatigue. This is the white paper. This is you can geek out on this. I just want to show you this very quickly. This is the adrenal glands, like you've ever heard of adrenal fatigue. All right, so the adrenal glands is the major gland in coping with stress. Now, if antibodies appear, which is positive, so once you have an autoimmune disease, you have it forever. You can never get rid of it. It's there forever. But what you can do, you can manage it. You can suppress it so it's not in full form, so it's not very aggressive. So you can bring it down and you can suppress it and you can get it into remission. That is possible with patients that work with me, clients that work with me. So here's all the different antibodies that you can have when you have these antibodies as positive, okay? So she has that. So here, also I'm just reading some of this. So this gland is the communication between the body's brain and the immune system and the metabolic system. Bam, what do we found? We found positive antibodies against the adrenal glands. Then down here, I don't have the white paper on this. This is heart. Antibodies against her heart tissue. Then down here, collagen complex. So what is that? Collagen complex right here. Positive antibodies against her collagen. Let's just go over this. Collagen is a group of proteins found in flesh and connective tissue, right? Collagen is the main component of connective tissue. So do you have joint pain all over your body that comes and goes and flares up? You probably have an autoimmune disease. Autoimmune diseases will come and go. They'll get flared up and then they'll come down, up and down, up and down, up and down. But over a period of time, your tissue continues to degenerate and your problem gets worse, right? So what we're looking at here is we're looking at, like, this is making sense now. Like, it's not a mystery. Like, there's actually, there's like a relief. Okay, I have an autoimmune disease, which is significant. Now what? Now we can do a whole bunch of protocols on this to get her better. And like, there's not one magic protocol because autoimmune disease is an individual case. You have to manage autoimmune disease individually. There's like 20 different things that could be happening in your disease, in your autoimmune disease, that we have to investigate to figure this out. So, high levels of antibodies, collagen complex are noted in autoimmune arthritic disorder, which just means what? Pain all over your entire body. That's what that means. Okay, so we got collagen. Down here we have osteocytes, which is bone. Okay, I'm not going to show you a white paper on that. Then guess what? Here we have myelin basic protein. Well, what's that? Let me pull this up. Myelin, see, myelin basic protein, MBP, myelin basic protein. That's where they get that, okay? Myelin basic protein. So myelin basic protein protects the sheath around the nerve. So if you have a wire and you cut a wire, that rubber like coating, that's the myelin sheath. She has autoimmune disease against that. Right, so let's go back to her symptoms. Would that cause seizures if your brain is demyelinating? Yes. Would that cause your body not to function well and walk? Yes. If you have collagen antibodies right here, this collagen antibodies, would that affect your ability to walk? Yes. Would this cause extreme fatigue? Like if your neurons aren't able to fire properly, that's going to cause extreme fatigue. So you can see how this is all starting to add up. And there's lots and lots of things that can be done if you have autoimmune disease. Now, if you go to the conventional system, they're just going to give you like steroids. That's it. Like there's so many things about doing autoimmune disease. And again, I'm pumped up because I'm connecting the dots with suffering people like yourself out there. Okay, that's why I'm getting pumped up. So various neurological disorders, including multiple sclerosis. Positive. Okay, then down here we have cerebellar. Now, your cerebellum is right in the back of your head right here, and that is the gating process that gates your brain. So what does that mean? That means that your brain here, when you talk about your brain, 90% of your brain is stopped. Okay, 90% is stopped. So most of your brain is used to stop things. When someone has a stroke, you see their arms is in spasm because they've affected their brain. Now instead of 90% stop, let's say someone has 70% stop and 30% go. Okay, let me just clean this up a little bit because this is an important concept to get. Okay, so here's what happens: is your brain is 90% is stop. Okay, 90% of your brain is stop. Okay, 10% is go. That's normal. 90% stop, 10% go. Like, for example, when someone has a stroke, their muscles become very spastic. What's happened? Now they have 70% stop and 30% go. Okay, so they're in spasm. They're spasming up. It's like if you have your car and you just put the metal to the pedal, you're revving your car up. This is what's happening when you have antibodies against your tissue, is you have 30% go. So you have seizures because every time any little stimulation comes in your brain, it's firing. Okay, so this is significant autoimmune disease. So let's go into the collagen here. Not collagen, cerebellar. Okay, so cerebellum is part of the brain controlling movement and balance. Guess what? She has horrible, horrible balance. So these are the antibodies, and these are the different diseases that can be caused in. And elevated cerebellar antibodies is an indication of neuroautoimmunity. So let's go back to this here. This her symptoms. Neuroautoimmunity. You see how everything here is starting to fire up. And you see how this is not letting me erase there. Okay, so back to the symptoms here. You can see here how all these different symptoms can be related to what's going on this test. So people can they can breathe. Okay, now what do we do? Okay, we're going to start with some basic autoimmune protocols, and they're individually based. It's not like a cookie cutter. I can't give you this piece of paper and say, do this if you have positive autoimmune disease. It just can't be done. You need a test, don't guess, and then move forward. So I realize that you're suffering out there, and I hope you have an array of light. And remember, if you're watching this, give me a thumbs up, subscribe, share it, get in contact with me, and let's do a phone call. So that being said, just remember, where there's help, there's hope. Take care. Bye-bye.